focus group sessions that provided the consumer perspective for this report. You told us what was important, you were heard, and your feedback and experience is not only reflected in the report, but underpins all the recommendations and MPA's priority for action. And that's why we need your help. Because a report is not enough. We want to create some action, and we'll talk shortly about those next steps. But just before we go any further, some housekeeping. So this webinar is being recorded and your microphones have all been muted. With only an hour available, we will be moving through this agenda fairly quickly. We encourage you to use the chat function and leave comments and questions. We won't be able to address them all tonight, but we will get back to you. If you've got any queries or that you'd like to address directly or help with anything in the toolkit, please email us at info@melanomapatients.org.au or look for the contacts on the new MPA website. A moment now to contemplate. As we gather for this virtual meeting physically in many lands, on the meaning of place, and in doing so, recognise the traditional lands on which we meet. This evening, I'm speaking from the lands of the Kaurna people.
And good evening, everyone. Tonight I am speaking from the land of the Yalukit Willem clan of the Boonwurrung people. Karen and I acknowledge elders, past, present and emerging, of all the lands on which we work and live, and we acknowledge their ancestral spirits with gratitude and respect. We also extend that respect to other Aboriginal and Torres Strait Islander people who are online tonight.
We'll just briefly introduce ourselves in case you don't know who we are. I'm a stage 4 melanoma survivor and thriver. I first came across MPA in 2013 when I was diagnosed and was honoured to help lobby for the subsidising of the drug Keytruda on the PBS, the Pharmaceutical Benefits Scheme, having been successfully treated on the trial for that drug. And when we do have a support group in South Australia, I facilitate it with my co-facilitator, Diane Fisher. I sit on the MPA board and I co-chair the Melanoma Patients Australia Consumer Advisory Group with Peter.
And that's me. Hello, everyone. My name is Peter Goulet. In 2017, I was diagnosed with stage 3B melanoma and undertook a year of immunotherapy as adjuvant therapy. At that time, just like Karen, I also learned a lot about the importance of networking and lobbying because the drug I needed was not on the PBS. Fortunately, today it is. With Karen, I am honoured to be the co-chair of the MPA Consumer Advisory Group. I'm also a member of Melanoma Research Victoria's Consumer Reference Group and the Peter Mac Consumer Register.
I'll just unmute. I'd like to give a very quick overview of Melanoma Patients Australia and our Consumer Advisory Group. So Melanoma Patients Australia is Australia's leading consumer support and advocacy organisation. It's created by patients for patients, and our purpose is to ensure that no one affected by melanoma walks alone. We do this by supporting, connecting and advocating for Australians affected by melanoma, and we work towards its prevention. So MPA delivers critical supportive care, and many of you will know that, and survivorship services to melanoma patients wherever they live in Australia and receives no government funding. The CAG, the Consumer Advisory Group, was established in 2020 to provide a powerful voice for people affected by melanoma across Australia and to ensure no one walks that journey alone. As a group of consumers, the CAG provides advice and feedback to MPA to influence policy change and health priorities that can benefit all the melanoma community. It's for this reason the CAG was so keen to host a consumer summit this evening after yesterday's launch of the State of the Nation report. Our aim is to encourage and support the melanoma advocates amongst you, to provide you with the information and tools to make a difference. This is the first opportunity we have planned, but there will be many more, and soon. We recognise also that everyone has different strengths, and we want to lean on all of them.
Thanks, Karen. We thought it would be really useful to get a very quick snapshot of who's online this evening. So we're going to do a very quick Mentimeter poll. We've put up on the screen an email address. Now, sorry, a website. This is really going to test my tech skills and perhaps yours, but let's see how we go with this. So if you've got access to a phone or another screen, if you could go to your search engine and go to www.menti.com, and when you get there, it'll ask you for a code, and the code is up there on the screen, and it's 6091 4466. So I'll let that just sit there for a few more seconds while we check if you can get on to Menti. And then I've just got a couple of really quick questions for you that'll give us a bit of a snapshot about where we're all from, etc. And Jody, I assume I can share my screen now, and let's see if we can get there. And can you see that?
Yes.
Excellent. So, and I guess on your mobile device or on screen, it just asks you to indicate where you live. So if you could just punch in the answer, and then I'm going to do something really tricky. Excellent. I'll just give you a few more seconds and we'll get a bit of a snapshot. And watch this. Whoa, that was fairly clever. So there's a blue dot for each person who's here tonight. A few more people joining us, that's fantastic. Perhaps not so surprising that there aren't so many from Western Australia, given the time difference. Interesting to get that snapshot. That's right, feel free to keep adding. Now what I'm going to do is move to the second question, and it's really about what hats you're wearing tonight. So there should be a second question on that poll. Are you a patient, a carer, perhaps a health or a support worker, or you're wearing another hat tonight? Just wait a few more seconds. Let's see how we go. So perhaps not surprisingly, lots of us are patients, a couple of carers, some workers, and really good to see that we've also got some allies in terms of researchers, partner organisations, etc. I'll just stop sharing that. Thank you very much for giving us that snapshot. That was about as technical as I can get. In terms of where we're going this afternoon or this evening, we'll be looking at a context and looking at the State of the Nation report, a report into melanoma, a national health priority that was launched yesterday, and Victoria Beadle, our CEO, will be doing that quick overview. We will explain MPA's new Spotlight on Melanoma campaign and the role of consumer advocacy. Karen is going to give us an overview of MPA's 5-point action plan developed to address the consumer needs that were identified in that State of the Nation report. I'm going to show you a series of new advocacy resources in the MPA new Advocacy Toolkit, which we are releasing tonight. And we'll also talk about the updated MPA website, the Spotlight on Melanoma page, and some next steps. I'll hand back to you, Karen, briefly to introduce Victoria.
Thank you, Peter. So yes, I'd like to introduce Victoria. She's the Melanoma Patients Australia CEO, Victoria Beadle. She's been our CEO since 2017, and she's moved us from a small organisation to an organisation that provides reliable and continuous support and perched on the edge of a critical period of development. Victoria.
Thanks so much for the introduction, Karen, and a very warm welcome to everyone. It's been a huge week for us all here at MPA with the launch of what is truly a landmark report for the melanoma community, the State of the Nation, a report into melanoma, a national health priority. It has been a 2-year-long journey working with our incredible partner, Melanoma Institute Australia, and the report authors at Insight Economics, who wrote the report independently. I'd like to say a big thanks to our sponsors who helped us create the report, particularly BMS, MSD and Novartis. And I want to say a special thanks to Novartis for making tonight possible and their ongoing support of our advocacy work. The report brings the melanoma community together to articulate a shared view of the challenges and the opportunities facing melanoma patients and their families and the wider healthcare system and Australian communities. The report certainly isn't a short one at over 200 pages, but it provides a level of detail never seen before with chapters on each stage of the patient journey. It provides a 5-point action plan and 25 recommendations. The full report and the executive summary are available to download on our website, and Peter will be telling you more about that later in the summit. It provides an expert roadmap on what actions and priorities are necessary to significantly reduce the burden and impacts of the disease. When we first agreed to start work on the report, it was fundamental to everyone at MPA that consumers' views needed to sit at the very heart of this report and guide its key recommendations. We embarked on one of the most comprehensive consumer consultation processes ever undertaken for a report of this kind. We captured the views of diverse and truly representative group of 1,200 patients and families from all states and territories impacted by all stages of melanoma. Many took great care and time to complete our survey, which took on average 45 minutes to complete, not a small survey, a detailed survey, and attended the consumer roundtable events that we held across the country. Our ambition was to ensure that the patient voice sat at the very heart of the report. We believe we've achieved this. The consultation process also extended to 36 clinicians, academics, researchers, policymakers and industry representatives and advocates, and over 400 GPs. Many of you may have attended the digital launch of the report yesterday, but for those that were unable to attend, I'd like to provide you all with a brief summary of the report's findings. The report reveals a number of key statistics which demonstrate the size and the scope of melanoma as a national health priority. Australia has the highest incidence of melanoma anywhere in the world. Melanoma is now the 3rd most common cancer in Australia after breast and prostate. An estimated 17,000 Australians will be diagnosed with melanoma this year. Melanoma is the most common cancer in young people, and an estimated 1,400 Australians will die from the disease in 2021. By 2030, without action, the report reveals that a further 18,000 Australians will die from the disease within 5 years of their diagnosis. A further 205,000 Australians will be diagnosed, and 348,000 Australians will be living with melanoma. And the economic cost of the disease will be $8.7 billion. But with action, the future incidence and burden of melanoma will be significantly reduced, and the quality of life for survivors, we believe, will be fundamentally improved. The report identifies a 5-point strategy, which includes the following areas: a modernised prevention and awareness strategy, investing in Australian world-leading research, improving early detection, reducing variation in treatment and diagnosis, and creating a model for supportive care and survivorship. All of these identified areas are worthy of careful consideration, but for us here at MPA, we are particularly concerned about one of the statistics in the report that has never been seen before. And it really affects the work that we do here and our passion for our patients and their families, the people that we provide support and care for every day through our various services. I'm going to reiterate the statistic that was shown earlier. The number of melanoma survivors is expected to increase by 2030 by 83%. An estimated 348,000 Australians will be living with melanoma. More than 205,000 Australians will be diagnosed with and treated for melanoma between now and 2030. That's 8 short years away. Every single melanoma survivor is of great importance and deserves the right support and care. MPA just doesn't have the resources to meet this exponential growth in patients needing help and support. And the report also reveals huge inequities in nursing care available to melanoma patients when compared to other similar cancers, such as breast and prostate. No one at MPA wants a single patient to be disadvantaged or not be able to receive the care and support that they need, and that is why we need your help tonight. No one affected by melanoma should have to walk alone. I'd like to hand you back to Karen, and she's going to talk you through our proposed action plan and how we need you to get involved. Thank you so much, everyone, for coming this evening.
Thank you, Victoria, for that introduction and an overview of the State of the Nation report. So as Victoria said, you told us what you needed through responding to the survey and attending the focus groups, and we listened. 50% of you said survivors did not receive adequate support following the completion of active treatment. The report identifies our needs, and some of those, as Victoria has said, MPA is best placed to meet. We have the expertise, we have the experience, and we have more and more people knocking on our door needing support that we are stretched to provide. Now is the time for melanoma to come out of the shadows. Now is the time for the government in particular to partner with MPA to provide what has been called a tsunami of survivors with the support that they need. MPA's Spotlight on Melanoma, another 5-point action plan, not to be confused with the State of the Nation 5-point plan, drills down and spotlights the key actions to overcome patient support and advocacy issues that the State of the Nation report identified. The focus is to provide more supportive care to people with melanoma from the moment of diagnosis, wherever they live in Australia. To improve care for people with melanoma through an enhanced network of melanoma nurses. Find better ways to ensure early diagnosis of melanoma. Ensure melanoma patients get faster and more equitable access to available treatments and clinical trials. And reduce the number of people diagnosed with melanoma. A big ask, you say? Well, let's break it down. So our first action is the provision of a national melanoma telehealth support program. With your help, MPA can provide so much more supportive care to people with melanoma from the moment of diagnosis, wherever they live in Australia, by an investment in a national melanoma telehealth support program. You've all had the experience of a diagnosis, whether it be a 1B primary, removed, or something more invasive. Having to deal with the confusion of understanding your pathology report or what your doctor has just told you. I called MPA when it was still a grassroots organisation, and I spoke to the brother of one of our founders. And it was so good to speak to someone who understood and who could explain things to me. And this is still happening for an exponentially larger group of consumers. In the State of the Nation Consumer Survey, survivors told us that they have high rates of depression and anxiety, as well as many health issues as a result of side effects of treatment. You told us that you find it hard to get support and care when you live in regional, remote and rural communities, and that you need support getting your life back on track after diagnosis and treatment. We need to create a national melanoma telehealth support program to provide a permanent support service to meet the growing and increasingly complex supportive care needs of all Australians. To do so, we need the support of government. MPA has been doing this for too long without government support. We're asking for 1.5 million per year over the next 3 years to employ 8 full-time multidisciplinary healthcare professionals with a focus on helping those who are isolated by diverse and disadvantaged backgrounds living in remote Australia. Action number 2 is to implement a national melanoma nurse support service. So you told us through the State of the Nation survey that development of a melanoma nurse support service was a top 5 priority. Heavens, I remember being given brilliant support by a breast cancer nurse after my axillary dissection. And I felt awfully like a poor cousin, only there because my surgery was similar to breast cancer surgery. These specialist nurses provide care and offer information and support throughout treatment. They help patients manage their complex cancer journey and overcome barriers to optimal cancer care. Patients with advanced melanoma require similarly complex care and support to advanced breast and prostate cancer patients. And melanoma has the highest rate of brain metastases of all solid tumour cancers. So the breast and prostate cancer nurse models are successful, and we're just asking that they be extended into the melanoma community. The State of the Nation report found that there were less than 10 government-funded melanoma nurses in Australia. The report states that adopting an equitable approach to oncology nursing would see the Australian government support an additional 84 melanoma nurses nationally, and this would require an injection of approximately 55 million in new funding for melanoma nurses that could be rolled out by MPA using the models piloted and proven for breast and prostate cancer nurses. Action 3 is to ensure early diagnosis of all melanomas. You asked us to find better ways to ensure early diagnosis of melanoma. Most of you reported that you or your partner found your own melanoma. So to ensure that this happens early enough to save lives, there's an urgent need to empower all Australians to know their skin, to identify the early signs of melanoma and when to seek medical help. Cancer Australia data for 2020 showed 14% reduction in diagnostic and therapeutic procedures relating to melanoma skin cancers. That's 11,245 less appointments for skin checks or treatment of melanomas in 2020 because of the COVID-19 pandemic. Implementation of this action is urgent to help us catch up with those people in time. So we want Australians, regardless of their cultural, geographic or socioeconomic status, to be able to know their risk status confidently perform self-skin checks, and detect changes and know when and how to get professional help. We want a commitment by the federal government to provide $2 million per year to MPA to deliver an expanded version of the successful consumer education Look Up, It's a Full Moon self-skin check campaign to promote increased awareness of their own skin cancer risk, the importance of regular self-skin checks, what to look for, and how to seek help with confidence. Action 4. We want to ensure melanoma patients get faster and more equitable access to available treatments and clinical trials. So Australians enjoy a high standard of care in melanoma. We know that. We have a globally leading survival outcomes. We've had high quality healthcare system, melanoma research and treatment breakthroughs, and PBS funding support for the best evidence-based care in the world. But the State of the Nation report shows that addressing the current unequal variation of melanoma treatment across Australia today could reduce mortality by 1/3. You've told us stories of not being able to get on a clinical trial because you didn't know about it or you couldn't afford to travel to it. I'm here today because my family was able to fly me to Melbourne fortnightly for successful treatment on a clinical trial, and that is not equitable. There are pockets of Australians who receive a lower than average standard of care due to their socioeconomic status. They can't afford to travel to the big city or pay for the new treatment that's not on the PBS, or geographic and financial barriers. They can't travel to or possibly even know about clinical trials that are only available in the big cities. We know Australia's regulatory and reimbursement system can create delays in publicly subsidised access to medicines, and that the PBS requirements can constrain how our oncologists can plan treatment and issues. There are issues also with access to novel therapies, particularly for rare melanomas. People often can't afford new treatments when they're not subsidised, causing very real inequities. Peter, my consumer advisory group co-chair, had to make the decision to use his superannuation to access life-saving treatment that was not yet subsidised. It was a distressing decision to make in order to access potentially life-saving treatment. We want faster access to new melanoma treatments, reduce variation in the treatment options, and access to clinical trials for geographically and socioeconomically disadvantaged patient groups, and for patients diagnosed with rare forms of melanoma. This is not a money ask. This is purely advocacy. We want the federal government to very quickly consider and implement the findings of the New Frontier Delivering Better Health for All Australians report, which came out in November of last year. It includes the implementation of fast-track approval processes for life-saving treatments, improving all patient access and projects to improve the visibility and accessibility of clinical trials for both patients and clinicians. It asks for the focus to be strengthened within the health technology assessment processes on rare cancers such as ocular melanoma and mucosal melanoma to improve equity of access to treatments for those patients. Action number 5. We want to reduce the number of people diagnosed with melanoma by developing and investing in a 10-year nationally harmonised skin cancer program. There's lots in that sentence. And you were insistent that a prevention program was a no-brainer. We see children without hats and sunburned teenagers, and we want to tell them our stories and to get them to understand the dangers. We know prevention policies are worth 3 times the amount invested in them, and that melanoma is caused by a known source, which means that it can be prevented. There is the potential, if we get this right, to reduce the incidence of melanoma, the actual incidence of it, by 45%. You told us you weren't happy that some safe behaviour programs didn't continue to high school and that the fragmentation of policy and delivery across Australia made it confusing and ineffectual. We love that the Australian government is funding the Cancer Council 20 million over 2 years to come up with an awareness program, the first since Sid the Seagull graced our shores in 1981. But that isn't enough. This needs to bite deep in the Australian psyche and stay for generations, and it needs to be adopted by every state and territory. We want a federal government to fund and establish a national skin cancer prevention task force with MPA as a lead member to ensure the patient voice is included, and collaboration between federal government, state and territory governments and local governments in partnership with other key melanoma and skin cancer organisations such as the Cancer Council, Melanoma Institute Australia, industry, researchers and other key stakeholders. The aim of this task force would be to scope and develop a 10-year nationally harmonised skin cancer prevention program to be funded by the federal government. You identified areas of need such as investment in shade, school sun safe behaviour, workplace sun safety training and sun safety in sport and outdoor clubs. And this is how we can make it happen. And remember, none of this is unreasonable, given that we know the direct financial costs and financial impacts of loss of life from melanoma in Australian communities are estimated to exceed 8.7 billion between now and 2030. As Victoria said, only 8 years. Let's do this. Over to Peter now for the how-to and the toolkit.
Thanks so much, Karen. Wow. You covered so much so concisely. What a comprehensive overview. And I really loved how you integrated so many of those, our consumer experiences in your presentation. So where to from here? We need your help, and we need your help to get the message out. It was very clear from your presentation, Karen, that the 5-point action plan focuses very much on the major patient support and advocacy needs that were identified in the State of the Nation report. To state the obvious, consumer feedback, consumer experience underpins, informs, and is actually the very substance of the State of the Nation report. And likewise, and therefore these experiences are very clearly reflected in the 5 action areas that were just outlined by Karen. That's why tonight is important. You have told MPA what was important. MPA has listened, and your feedback and experience are not only reflected in the report, but underpin the recommendations and MPA's priorities for action in its action plan. So that's why we need your help. As has been said a couple of times already, a report is not enough. What we need to do at this time is to create some momentum and action, and we'll talk shortly about some of those next steps. Obviously, the State of the Nation is a big agenda, but the action plan, as explained by Karen, focuses on those things that MPA believes it can actually influence, and it can influence those things if it can draw upon the experience, the stories, the networks of us as patients, carers, and consumers. And as I said before, it's obvious that publishing a report is not enough. It's incredible context, no matter how good or comprehensive, it's a great platform, but in reality, we need to get that message out there. We've all seen plenty of fantastic, groundbreaking reports that look magnificent on shelves, that fill up filing cabinets. And so that's the challenge, is bringing all our expertise and networks and looking at that 5-point action plan and working out how we as consumers can use our voice, our experience to add to the momentum towards change. It's interesting and important that we're very mindful of time. An election is imminent. So in lots of ways, at least politically, federally and in some of the states and territories, there are also elections looming. It's actually perfect timing for advocacy, to do some lobbying, to do a bit of stirring, to do lots of talking, a bit of door knocking, to influence government, but also to influence decision makers. We need to let them know what is important to us as melanoma patients and as carers. So again, to state the obvious, it's important to remember that it's our voices and it's our stories that can give power to advocacy and lobbying for change, and make that lobbying and advocacy real and relevant. There is obviously real power in our story. I think we make the assumption that it's actually very hard to ignore someone and not to be moved by someone when it's eyeball to eyeball, face to face, when we talk about our story, our needs, our frustrations, our good stories and our bad stories. Sometimes when organisations front up, as organisations and knock on doors and say, we've got a vision, sometimes they can be judged as just wanting funding. I guess our role is, what difference will that funding make? And it's about making a difference in terms of access and improved services along the lines of the agenda and that plan for change outlined by Karen in the 5-point action plan. Our stories are important, and I want to acknowledge that many of you, and thank many of you who have already shared your stories on the MPA website. Our melanoma movement volunteers, and there are many of you online tonight, and also more recently, those of you who participated in MPA's recent Touched by Melanoma storytelling campaign at the end of last year. So an important part of tonight's presentation is to show you some of the advocacy materials, resources, suggestions, checklists that we've put together, and we've called it an advocacy toolkit. This slide just gives you a quick overview of what's in that toolkit. You might even call it a smorgasbord or a suite of resources. And they're very, very neatly put together on the new and revised, improved MPA website under the heading of Spotlight on Melanoma. Obviously, you can access the State of the Nation report, the action plan that Karen went through. So if we just have a look, the website, as I said, is new and improved. The place to access the information about the Spotlight on Melanoma advocacy strategy and campaign is to go to the menu and click on Get Involved. And that will take you to the Spotlight on Melanoma homepage, if you like. You'll also find ways of becoming a melanoma advocate there, becoming part of the melanoma movement, and links to MPA resources and its other supports. The first thing you'll see on that slide, on that page, is the State of the Nation report that was launched yesterday, and we've heard Victoria and Karen talk about that report and the input that came from us, 1,200 of us, patients and carers, but also GPs, clinicians, researchers, as well as an incredibly comprehensive lit and research review. It's based most importantly on experience, personal experience, lived experience, and professional experience. And it pulls all of that together into a shared vision of the challenges and opportunities. So the State of the Nation report is really about where we're at, and importantly, a bit of a roadmap to where we want to be. Up on the screen now is the, you'll find on that, on the website, under the resources section on the Spotlight on Melanoma campaign, a link to the 5-point action plan. And this is really about how we get there. State of the Nation is where we're at, where we want to be. As you've heard, this is how we can get there. This document very, very concisely spotlights and highlights those key action areas that Karen went through, and very systematically, neatly presented over a couple of pages for each action. What's the issue? Very importantly, you'll see the consumer, patient, carer voice reflected there. What do we know? What do we want to achieve? And how can we get there? Very, very helpful. There's also an infographic or a key, a sheet on the key facts. So a nice one-page, simple, useful, clear overview. You can see them there listed 1 to 5, those action areas. And just also, I guess, running down the left-hand side very usefully are some of those key statistics that, that Victoria led us through. The next resource is an advocate's guide to meeting with politicians. So what we're really wanting to do is to engage with our consumers as advocates, and where appropriate, and where people are keen, we would like to support you to go knocking on a door or two, to write a letter, to ask your local member of parliament to get a message to the Minister for Health. You can see the first page of this this guide. It's clear and simple and quite practical. It's really some handy hints. It goes through what do you need to, if you're going to go and meet with a member of parliament, what do you want, how do we set that up? How do you prepare? What do you need to do before the meeting? Things to think about. What do you need to take with you? What are you going to talk about? And there's some questions and some prompts, and maybe you're not going to talk about everything. We would suggest you're actually going to start by talking, to the degree you feel comfortable, a little bit about your own story, and maybe pick one of those actions for change that is contained in the action plan and put that to your local member of parliament. Ask, are they aware of the State of the Nation report? Would they like to have a copy of our action plan? Is there anything further information that they would like? Would they, as your local member, be prepared to write on your behalf, and I guess on behalf of MPA, to the Minister for Health to help us achieve, to help you achieve that agenda for change? And most importantly, there's some hints about what to do after the meeting. We'd really like to know if you've had the opportunity to meet, to write with a member, write to a member of parliament. How did that go? What happened? What did they say to you? Tell us about that. There's also a simple guide to communicating with your federal member of parliament, your local politician. It's a simple one-pager, but it's full of active links about, and most importantly, checking who your local member is. How do you find your local member? So there's a handy link there that will help you identify that local member if that person's not known to you. There's also, and I'll show you this in a moment, a template letter. There's a link to a letter, and I'll explain that you can use as a basis for putting a letter together to your local member of parliament. And there's also a link to that earlier document about preparing for the meeting, and also a reminder that we would really like to know at MPA what you did and how it went. Also on that document, there's a bit of a suggestion that you might like to approach your state or territory or federal Minister for Health directly, not just your local member of parliament, and perhaps write directly to your local Minister for Health. That's certainly one thing that I'll be doing. He's actually Martin Foley. I'm in Melbourne. He's actually one of my neighbours. He lives just round the corner. We nod. He probably doesn't know my name, but I'm about to write him a story. And I think I might even ask him if we can have a meeting. I know he's got a lot to think about just at the moment, but we're neighbours. I'm in the electorate. There's also a second version of that, communicating with your federal politician. This is designed more for approaching your local, state and territory MPs. Again, links to finding out who those people are, and similar resources and links to the federal MP. As I mentioned, there's a downloadable letter template. You can see, you may not be able to read that very carefully on that PowerPoint on your screen or device, but you'll see there's some blocks of colour in yellow. So there's a framework for a letter that you can edit, that you can cut and paste. It might even inspire you to put that to one side and start again from your own perspective. At the heart of that letter, there is the encouragement to personalise it, and a little bit of a clue as to what your personal link is to melanoma. Then there is, we've also got some very useful social media suggestions, hashtags, tweets, some tiles, some images that you can be using. If you are a person who uses social media, these are really useful resources. It's a start. It's not everything. This suite, this smorgasbord of resources to empower, to encourage, to motivate us as patients and carers to spread our story. I think we're definitely focusing initially on getting that message to to government via our local members, and making that part of a campaign to put the spotlight on melanoma. Karen, I might just hand over to you, back to you at this point.
Thank you, Peter, and that was magnificent. Tools are there, and we know the passion's there. So let's go do this. And as I said before, you can contact us. You can come and talk to us. You can send us a message if you want to talk about what you think you might do, but you'd like some advice. We're here, and we can help you. So thank you, Peter. That was magnificent, and really useful.
Now,
so the campaign.
What I thought I might do is just go back to that Mentimeter, Karen.
Yes, I was going to say the campaign's going to run for a month.
Beautiful.
It's going to become
What's
part
going to happen then, Karen?
Pardon?
What's going to happen after the month?
And then it's going to become part of MPA's ongoing advocacy strategy. So the challenge now is to take action. Don't sit on it, do it now. Peter, go with the end of the Mentimeter. I love it.
Just thought, just to wrap up, we've had a lot to think about, a lot we can think about. I just want to go back again, if I can, and I'm really testing my technological skills here, digital skills. There's that, it might still be on your device or on your screen. There's that address, www.menti.com, and the code 6091 4466, and I'll give you a few seconds before I remove the slide to log back into that poll. And Jody, I'll share my screen now and see if I can do this successfully. And I think I've done that. And the question we're just asking as we come towards the end of the hour, we've given you a lot to think about. There might be some options, some things that you might do, places you might visit, things you might look up. Maybe you'll start to think about, have a look through those, that advocacy toolkit. If you don't mind sharing some of the things you might do as a result of tonight's summit. What you write, clearly it's not confidential, because in a second I'm going to show some of the results as they come up on the screen, but they're anonymous. So we'll just have an opportunity in a second to see what's coming up. And in fact, we might start to do that. That doesn't mean you can't keep adding to your thoughts. Meet with my MP, write to the Health Minister, check the MPA website, check out those tools. Meet with the Shadow Health Minister, might be a good idea. Write a letter, write to my local state minister. Look through the toolkit, read the action plan, read through the report. And I meant to mention when we were talking about the State of the Nation report, when you go to the toolkit, you'll see that full comprehensive report there. As Victoria said, it's well over 200 pages, but there's also sitting alongside that as a separate download is the executive summary. So I think that's maybe just 35 to 40 pages that gives you a very comprehensive overview. I'm a leadership recruiter, social media, letter contacts, become an advocate. And the link to becoming a melanoma advocate and an MPA advocate is right on that page of Spotlight on Melanoma. Share my story. Thank you for that. Read through the State of the Nation report, look at the toolkit, and look at the toolkit is an excellent place to start. Join MPA. And again, the opportunity and form for joining MPA is right there on the Spotlight on Melanoma landing page. Thank you very much. We're going to keep these responses. I might, in fact, we could just leave them. I'll just leave it open for another few seconds. If you wanted to add a second thought, if you haven't already, you would be most welcome. And in fact, I have a feeling, even after I stop sharing this on screen, if there are additional thoughts, so long as you've got that Mentimeter poll open, you can continue to add comments. So they won't be lost. And I promise you, we'll be looking at them carefully. So I'll actually stop sharing. I'll come back to you, Karen. And
Thanks,
I think there we are. I think we have a few thank yous. I know one of the comments you made to me during the week, Karen, and we haven't locked this in, but I think as a consumer advisory group and as a group of advocates and MPA, we might have a chat about, tonight's been fairly formal, it's been an overview, but as we can see from the response about those next steps from our participants tonight, that we might set something, a bit of a round table up where we can share, swap ideas. This is what we're going to do. Who's tried this? How did this go? Handy hints, a bit of peer support for each other for those who would like to take this to the next step. I think that sounds a pretty good idea.
Absolutely. I'm more of I like to have a good chat with people and share ideas. And it often makes what you do, you're a lot more confident about what you're doing, and you get ideas from other people about how you could enhance what you're doing as well. And I think we need to also thank again everyone who's contributed to the State of the Nation report through the survey and the consultations. That was a 45-minute survey. That was a big ask. And some people had to dig through a lot of memories and things they might not like to remember. So that was absolutely magnificent, and it really made this report pop. It gave life to otherwise quite dry statistics. And your voices have made a difference. We can see the voices reflected in the report, the 5-point action plan, and the Spotlight on Melanoma Consumer Advocacy Strategy.
To conclude, a couple of other thank yous. I also absolutely concur with you and thank everyone who's been online for your attendance, your interest and your time. An extra large thank you for those who have contributed through adding their voice to the report, to the action plan, through the survey, as you say, and the consultations. A very, very special thank you to Victoria, Sarah and Jody, and in fact, all the team and our colleagues and supporters at MPA. Behind the scenes, what has been achieved in the last 24 hours, 48 hours, week, month, it's not just, it's come together very, very quickly, and a lot of work has gone into not just the toolkit and the action plan, but it's how it's presented. Thank you so much to Victoria, Sarah and Jody for all of their work, and the rest of the team at MPA. for a...
I've just thought of someone else I'd like to thank, though. The Consumer Advisory Group.
Yeah.
They put a huge amount of time into rereading, discussing, listening and making suggestions. So thank you to everyone who's on the Consumer Advisory Group, that you stepped up and you delivered, and that's what we're there for.
Most importantly, don't forget what Karen said right at the beginning, that if you have questions, if there's clarification, if you get lost on the website or we've mentioned something and you can't find it or it raises a question for you, then you can email, you can phone MPA for assistance. Don't let it hang. We will get back to you. We will let you know about a more informal discussion, peer support and encouragement around these issues to assist you to take it to the next level where you're available and where you are interested. So once again, thank you, Karen, as well. I know.
Thank you, Peter.
I know you were very heavily involved in the launch of the State of the Nation yesterday, along with Victoria, and you weren't sitting at home in front of a computer to do that. You had to get up to Sydney and be involved up there. So thank you for that. Once again, thank you everyone for your attendance, your interest and your time. Good night and stay safe. Thank you.
Good night, everyone.